In this video, we will be covering the following points: coronavirus total number of deaths recorded so far and best ways to stop the spread, coronavirus countries affected, coronavirus preventive measures, and the best approved coronavirus prevention mask to use for now. If you move from one place, one country to another, in as far as you are mobile, this video is for you. It's time to wake up to the current reality and let's face it squarely before it hits any of us or our loved ones. So let's get started. Coronavirus total number of deaths recorded so far. The novel coronavirus has killed more than 1,113 people and infected over 45,000 people worldwide. The vast majority of cases are in mainland China. The number of coronavirus deaths has overtaken that of the SARS epidemic in 2003. Hundreds of cases have been confirmed elsewhere, with the virus being reported in about 25 countries in the Asia-Pacific region as well as Europe, North America and the Middle East. Here are the countries that have so far confirmed cases of the new coronavirus. Australia, 15. Australia has confirmed 15 cases of the virus as of February 11th, including 3 people who have already been discharged from hospital, according to the Australian government. Most of the patients arrived in the country from Wuhan or Hubei province. Belgium, 1. Belgium said on February 4th that one of 9 Belgian citizens repatriated from Wuhan had tested positive for the coronavirus. Cambodia, 1. Cambodia confirmed its first case of coronavirus on January 27th. Minister of Health Mam Bunhang said the patient was a 60-year-old Chinese national in the coastal city of Sihanoukville. Canada, 7. Canada has confirmed 7 cases of the coronavirus as of February 11, 3 in Ontario and 4 in British Columbia. China, 44,653. As of February 12, at least 44,653 people in mainland China were confirmed as having been infected with the virus, most of them in and around Wuhan. At least 1,113 people have died, China's National Health Commission said. The city of Macau, a gambling hub hugely popular with mainland tourists, has confirmed 10 cases. Hong Kong reported its first death from the disease on February 4 of a man who had traveled from Wuhan. At least 50 people, including the deceased man, were confirmed to have been infected as of February 12. Finland, 1. A Chinese tourist who was admitted to hospital for tests was confirmed on January 29 as having been infected with the coronavirus. The patient is said to be a 32-year-old woman from Wuhan. France, 11. French health officials confirmed 5 new cases of the coronavirus on February 8, bringing the country's total to 11. The new cases were all British citizens who had shared a chalet at a French ski resort with someone who had recently traveled to Singapore. France was the first European country to record cases of the virus. Germany, 16. Germany has registered 16 confirmed cases of the coronavirus as of February 11, with a majority of those infected in the southern state of Bavaria. Almost all of the patients in Germany are employees of the auto parts supplier Webasto, who were infected by a colleague from China who was attending a course in Germany. India, 3. On February 3, a third positive case of the coronavirus was reported in India's southern state of Kerala, the country's health ministry said. All 3 are students who returned from Wuhan, according to local media. Italy, 3. One of 56 Italians evacuated from Wuhan has tested positive for the new coronavirus, the health ministry said on February 7, bringing the country's total number of cases to 3. On January 30, 2 Chinese tourists were reported as having tested positive for the virus. Japan, 28 plus 175. A total of 174 people on the quarantined Diamond Princess cruise ship docked at Yokohama and a quarantine officer had tested positive for the virus, as of February 12. Japan does not include the people on board as part of its national tally, in accordance with guidance from the WHO. The total for Japan is 28. Malaysia, 18. On February 10, Malaysia reported its 18th case of coronavirus, a man who had visited mainland China before returning home in February, the health ministry said. Most of the cases in Malaysia are Chinese nationals, but at least 2 Malaysians have also been infected. Nepal, 1. Nepal said on January 24 that a 32-year-old man arriving from Wuhan had tested positive for coronavirus. The patient, who was initially quarantined, recovered and was discharged. The government said surveillance has been increased at the airport and suspicious patients entering Nepal are being monitored. The Philippines. 3. Philippine health officials confirmed a third case of coronavirus on February 5, including the first death from coronavirus outside China, which was announced on February 2. Russia. 2. Russia reported 2 cases of coronavirus on January 31. Both patients, Chinese nationals, have recovered and were discharged from hospital by February 12. Singapore. 50. Singapore on February 12 raised the number of confirmed cases to 50. The city-state has the highest tallies outside China, including mounting evidence of local transmission. South Korea. 28. On February 11, South Korea reported 1 new case of the virus, bringing the country's total to 28. Spain. 2. Spanish authorities confirmed the country's second case of coronavirus on February 9, a British man in Mallorca. The patient is one of 4 members of a British family taken into observation on the island after coming into contact with someone in France who was subsequently diagnosed with the virus. The other 3 were tested negative. The first case, reported on January 31, was in a man on the island of La Gomera in the Canary Islands. Sri Lanka. 1. Sri Lanka confirmed its first case of coronavirus on January 27. The patient was identified as a 43-year-old Chinese woman from Hubei province who had arrived in Sri Lanka as a tourist. She was admitted to the Infectious Diseases Hospital. Sweden. 1. On January 31, Sweden's public health agency said a woman had tested positive for coronavirus and was being kept isolated at a hospital in southern Sweden. The woman had visited the Wuhan area in China and began coughing after she arrived in Sweden. She contacted a hospital in southern Sweden, where she is being treated. She is not gravely ill, the agency said. Taiwan. 18. Taiwan confirmed its 18th case on February 9, a young woman in her 20s who has not shown any symptoms of the viral infection, Health Minister Chen Shih-chung said at a press briefing. Thailand. 33. Thailand confirmed 1 new case on February 11, bringing the total number of coronavirus patients in the country to 33. The new case is a 54-year-old Chinese woman from Wuhan who was put in quarantine after coming into contact with another Chinese virus patient while in Thailand, said Suwanchai Watanayang Charunkia, the Director General of the Department of Disease Control. United Arab Emirates. 8. The UAE confirmed 1 new case on February 10, bringing the country's total to 8. The country's health ministry said the patient was an Indian national who had come into contact with a recently diagnosed person. On February 1, the UAE became the first country in the Middle East to confirm cases of the coronavirus. It is the only country in the region to report cases. United Kingdom. 8. The UK confirmed 4 new cases of coronavirus on February 10, taking the total number in Britain to 8. The first 3 cases in the UK were reported on January 31 and 1 on February 9. All 8 cases are in England. United States. 13. The US had confirmed 13 cases of the virus as of February 11. The latest infected person was brought from Wuhan on board the first US evacuation flight. Vietnam. 15. On February 11, Vietnam confirmed 1 new case, a 3-month-old baby infected by her grandmother, bringing the country's total to 15. The authorities have said 10 of the cases were in the northern province of Vinh Phuc. World Health Organization coronavirus preventive measures. Wash your hands frequently. Wash your hands frequently with soap and water or use an alcohol-based hand rub if your hands are not visibly dirty. Why? Washing your hands with soap and water or using alcohol-based hand rub eliminates the virus if it is on your hands. Practice respiratory hygiene. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue. Discard tissue immediately into a closed bin and clean your hands with alcohol-based hand rub or soap and water. Why? Covering your mouth and nose when coughing and sneezing prevent the spread of germs and viruses. If you sneeze or cough into your hands, you may contaminate objects or people that you touch. Maintain social distancing. Maintain at least 1 meter (3 feet) distance between yourself and other people, particularly those who are coughing, sneezing and have a fever. Why? When someone who is infected with a respiratory disease, like 2019 nCoV, coughs or sneezes, they project small droplets containing the virus. If you are too close, you can breathe in the virus. Avoid touching eyes, nose and mouth. Why? Hands touch many surfaces which can be contaminated with the virus. If you touch your eyes, nose or mouth with your contaminated hands, you can transfer the virus from the surface to yourself. If you have fever, cough and difficulty breathing, seek medical care early. Tell your health care provider if you have traveled in an area in China where 2019 nCoV has been reported, or if you have been in close contact with someone who has traveled from China and has respiratory symptoms. Why? Whenever you have fever, cough and difficulty breathing, it's important to seek medical attention promptly, as this may be due to a respiratory infection or other serious condition. Respiratory symptoms with fever can have a range of causes, and depending on your personal travel history and circumstances, 2019 nCoV could be one of them. As a general precaution, practice general hygiene measures when visiting live animal markets, wet markets or animal product markets. Ensure regular hand washing with soap and potable water after touching animals and animal products. Avoid touching eyes, nose or mouth with hands, and avoid contact with sick animals or spoiled animal products. Strictly avoid any contact with other animals in the market, e.g., stray cats and dogs, rodents, birds, bats. Avoid contact with potentially contaminated animal waste or fluids on the soil or structures of shops and market facilities. Avoid consumption of raw or undercooked animal products. Handle raw meat, milk or animal organs with care to avoid cross-contamination with uncooked foods, as per good food safety practices. Best recommended mask to combat this by World Health Organization. Currently the best mask to use is the OXYBREATH Pro, an antibacterial, anti-pollution mask which is more effective than every other mask types. OXYBREATH Pro mask effectively filters polluted air and blocks bacteria spread. On the last note, everyone should take extra care. And remember, prevention is cheaper than cure. Details of how to get the OXYBREATH Pro mask if you are interested, is in description under this video. All the best.